With rising COVID cases and heightened concerns surrounding the Omicron variant, the province's chief medical officer of health announced new measures today with the goal of keeping the holiday season a safe one.
Well, part of those measures include expanding booster shots to those 18 plus and having QR codes mandatory for proof of vaccination. Both measures take effect in the new year. We'll hear for reaction, help us break it all down, and of course with their expertise. We're joined by Fahad Razak, internist at St. Michael's Hospital and member of Ontario's COVID-19 Science Advisory Table, and epidemiologist Colin Furness with the University of Toronto. Gentlemen, thank you both for being here tonight. First question I have is for Dr. Razak. We're looking at the numbers. You know, we see they're on the rise, the highest since last May. But when the numbers are being broken down, we are seeing that the number of people vaccinated are the ones who are hospitalized more than those unvaccinated. I think the number was 700 and something versus vaccinated, 600 unvaccinated. Can you help us understand this?
Yeah, I think the number you're referring to is the total number of infections, and you're seeing that, you know, approximately half, depending on when the samples are done and which day, are from the vaccinated. But remember that approximately 90% of the population is vaccinated. And so there's just a much bigger pool of people that you're drawing from. If you are vaccinated, and we've shown this conclusively in our science table reports week after week after week, your chance of getting an infection is probably 6 to 7 times lower. Your chance of getting a severe infection, ending up in hospital or in the ICU, is probably 20 to 30 times lower. So there's really no replacement for the protection of the vaccine. It's just how many doses we need now. I think that's the open question.
So it's about the vaccine. Is it waning now, the waning effectiveness? And thus we have the announcement today about the boosters for 18 plus coming in January now.
Yeah, there definitely has been a waning effect, and we've seen this from data in other countries for the Delta variant, that there's a waning effect. Exactly when it sets in and which risk groups, that's a little bit less clear because each country did set out its own vaccination paths. So, for example, in Canada, we had longer delays between our first and second dose than most countries, and that does affect when that waning starts to begin. But importantly, there is now the new information about Omicron in the last week, suggesting that that third dose, and I think increasingly we should just call it a third dose and not a booster, is essential for protection against Omicron. Now, that is emerging evidence. It's not conclusive, but I do think that there's enough to suggest that we need to act on it for that reason as well.
Fahad, I want to bring those numbers. I was looking at the numbers here. So the number of new cases today, 1,453 new cases of COVID-19, 613 involve those who are unvaccinated. And as Stephanie noted, 718 are in people who received at least 2 doses. So as you said, the majority of the population is vaccinated, so there's a larger pool. Colin, Colin, when we take a look at the measures announced today, vaccine certificates beyond January the 17th, those 18 plus in the new year can start to get their third dose. Those 12 to 17 must be vaccinated to take part in organized sports at recreational facilities. Does this go far enough?
Oh gosh, no. All those things are important. All of those things are vital. I was happy to hear them all, but I want to be really clear. The data is extraordinarily clear. We're seeing giant amounts of COVID cases in primary schools. None of the measures announced today even acknowledge that.
Yeah, so I wanted to ask you about that actually too. I mean, and this is something Fahad, who's a member of the science table. I mean, what the science table have been calling for is rapid testing for elementary school students.
Yeah, absolutely. I mean, I think so. Go ahead.
Sorry, Colin. I wanted to point out, as you noted, we're not seeing anything specific to those younger kids, which is what we've been talking about in the last few days. Colin, if you want to begin.
Certainly, rapid testing would be enormously important, but we also desperately need an order from the Chief Medical Officer of Health that unvaccinated adults may not enter schools. We just have to do it. It's very simple. I've looked at the data carefully. There are plenty of examples in Ontario schools where there's been staff-to-staff transmission and then staff-to-student transmission, and you can see it temporally. The data's there. It's very, very clear. This is insane that we're letting unvaccinated teachers in schools. The fact that we're then not doing rapid testing to contain it makes it worse.
And Fahad, if you want to comment, I mean, were you thinking today, I mean, why didn't they move forward with our specific suggestion?
Yeah, so so Dr. Furness's point around requiring vaccines, we were asked to advise on this, for example, in the healthcare sector. So should you require that healthcare workers or any hospital worker is vaccinated? And our answer was yes, it does make sense to do it. And the urgency of doing that now is higher than ever. Case rates are rapidly escalating without even the Omicron variant being in place to start to drive that. So I think the next couple of weeks are going to be probably very concerning in terms of the case numbers and potential spin-out effects. And that requirement for vaccination to be in any public space where you're exposing vulnerable populations. In a hospital, it's patients. In a school, it's unvaccinated children. We don't have a vaccine for children under age 5, including both of my children who are under age 5.
There's something else that's developed just in the last day that is a real eye-opener, and that's what happened at this Giants of Africa event on Sunday night, where a lot of the people who attended that event are now being asked to isolate. Not only that, though, Toronto Public Health is asking anyone who attended the Raptors game last Sunday to, keep an eye on their symptoms. We've never seen that before, throughout the pandemic, and now suddenly here we are, vaccinations are here, and the warnings about being in these public spaces. Like this is, should we be going out to anything, like a hockey game or a basketball game right now, given what we're seeing with Omicron and the waning immunity of the vaccine?
I don't think we ever should have opened stadiums full blast. I don't think we ever should have done that, and I've been saying that consistently. If you look at actual behavior, queuing around bathrooms and concession stands and public transit, that's incredibly inappropriate, and we're going to see more and more where large gatherings produce super spreader events. This is COVID's modus operandi. This is what COVID really thrives in, so we really have to stop giving it that chance.
Colin, Dr. Moore saying today that schools remain safe, but he'll keep an eye on the situation in schools. We had learned that the provincial government was initially during the week taking a look at a couple options, but shutting down schools and pivoting to online learning only was taken off the table. Was that the right move?
I think it might have been helpful to close schools a few days early. We're getting close to the holidays, but every day I think we're seeing more and more cases in schools. It's concerning. COVID causes organ damage. It causes autoimmune disease. It causes brain damage. I think putting kids in schools to score political points is really, really misguided. I think if we don't take serious steps, and I think unfortunately we're going to have to pull back on things like restaurants. If we don't take serious steps, I'm not sure we're going to be able to open schools in January. That's my concern.
Yeah, Fahad, I wanted to ask you the same question and pointing out that the City of Toronto's Associate Medical Officer of Health said several days ago that the largest infection group in the City of Toronto right now is children by age group.
It's very concerning. I agree with Dr. Furness that this is where the largest population of people getting sick are right now. And part of our brief this week about rapid testing that was prepared by Dr. Uni really argues for the fact that these tests are available. They've been provided by the federal government. They need to be deployed in settings where they can make a meaningful difference. And, I think the acuity of the situations in schools right now is probably only going to get worse, unfortunately, with Omicron coming through. And we have to be able to react quickly. We have to deploy every mechanism we can to keep these schools safe. And probably there's going to have to be more school closures if this continues to spread the way it is.
And Fahad, beyond the schools, let's talk about, you're on the science advisory table. Is it almost time to have some kind of adjustment? Might we see it for the numbers on gatherings in public places, right? Like we know that there's some numbers that have changed, or they put a pause on the opening of some places, but are we going to see indoor gatherings get a new limit possibly looking ahead?
Yeah, look, I say this with the same wariness of everyone else who's been through the last 2 years, which is this was going to be a really important holiday season for all of us. I do think it's unfortunately at a point of instability right now about the safety of large gatherings. The steps which are key now are ensuring everyone's vaccinated, using those masks, probably starting to reduce down to essential gatherings. We've seen some pretty concerning events develop with Omicron spread in group settings. So, for example, a dinner in Oslo, Norway that we've been examining, where 110 guests approximately were present, and everybody was double vaccinated, and they had to show proof of vaccination, and there was some use of rapid screening prior to the event. Probably approximately 80 of the 110 people became infected. That's very concerning. These are healthy, these are adults who are healthy, who are double vaccinated. That is an alarming degree of spread, and I do think that it's a time for caution.
All right, with that, we leave you, gentlemen. Thanks so much for your time and for your expertise. We really appreciate it.
Thank you, Dr. Razak and Colin.
Great to be with you.